Hello, my name is Hema Veeramachaneni, and I'm a gastroenterology fellow at Emory University School of Medicine. And I created a poster on cirrhosis and hepatic encephalopathy with my mentor, Dr. Mary Flynn. So, why does cirrhosis cause confusion? Well, the liver in itself is responsible for filtering out a lot of the toxins and waste in your blood. When a liver becomes cirrhotic or extremely scarred and in end-stage liver disease, it's no longer able to perform these functions. And one of the toxins that gets built up is called ammonia, which leads to confusion as it builds up around your brain. So, in a healthy liver, as you can see, the ammonia from your blood is taken out, broken down, and you urinate out the byproducts. But in a cirrhotic liver, that ammonia is not able to be broken down, so it stays in your bloodstream, leading to confusion. And so, how do we note the severity of the confusion or the severity of the hepatic encephalopathy? Well, we have grades of hepatic encephalopathy that we look at. And so for patients, it's important to kind of recognize the signs and symptoms and for the family members to identify when these are occurring. So in the mildest form of hepatic encephalopathy or grade 1, you'll see some mild confusion, some irritability, some change in behavior, and changes in the sleep cycle, meaning they're awake when they're supposed to be asleep and vice versa. As the encephalopathy gets worse, grade 2 is noted where there's some drowsiness, really fatigued, or personality changes. Now, once you get to grade 3 and 4 is when the alarms really start going off because the patient in grade 3 has incoherent speech, they're sleepy, but they're arousable, and they're having maybe some aggressive behavior and sometimes even seizures. Lastly, in grade 4, you're really concerned because the patient's in a coma and they're not responsive. If the patient is in grade 3 or 4, then that means that they need to be taken to the emergency room immediately because further care needs to be taken. But how do we prevent this from occurring in our cirrhotic patients? First off, the way that ammonia can be taken out of the body in a cirrhotic patient is through the bowel movements. And so lactulose is one of the medications that we use. We encourage patients to take this at least 3 to 4 times a day to ensure 3 to 4 good large bowel movements. This ensures that ammonia is being cleared. Sometimes physicians also prescribe a medicine called rifaximin, which is an antibiotic, to further help with removing lactulose. Lastly, it's very important to not take new medications over the counter or other prescription meds without talking to your physician to ensure that they won't contribute to hepatic encephalopathy. Overall, this is a condition that can be very scary due to the confusion, but is very treatable and preventable with the right measures. Thank you.